Hi, I'm Karen Damshin with Damshin Financial Planning. Today we're going to talk about a couple of big news items that are affecting all kinds of health insurance throughout the country. First and foremost, about 50 health insurers, including Elevance, United Healthcare, Humana, Cigna, CVS's Aetna, a slew of Blue Cross Blue Shield plans, are leading the charge for an initiative that they're making a commitment to reform one of the biggest pain points in the consumer experience, which is prior authorizations. So this announcement says that this commitment is going to stretch across various insurance markets, including commercial plans, Medicare Advantage plans, and Medicaid managed care. So potentially affecting about 257 million Americans. The insurers claim they're going to improve transparency, communication, and give a lot more information around the determinations that they make. Patients will be offered an explanation for the determinations that are clear and easy for them to understand, along with directions on how to appeal should they need to do that. They've promised all of this is going to be in place by January 1 of 2026. So some of the other commitments include providing continuity of care if someone changes their health insurance plan in the middle of a treatment, and 80% of prior authorizations starting in 2027 are supposed to receive what they call real-time determinations. So those should come much more quickly. While this commitment step in the right direction, I'm glad to see some movement. I think it remains to be seen whether or not you actually feel a change in your overall experience with the healthcare system. So, second big piece of news was on Friday, the Centers for Medicare and Medicaid, or CMS, issued a final rule that is intended to crack down on what it calls improper enrollment in the Affordable Care Act plans. So think the marketplace plans. This final rule is supposed to save taxpayers overall about $12 billion in 2026. And it's potentially going to lower individual health insurance premiums by an estimated 5%. We'll see if that actually happens. So the first part of this rule reinstates a lot of policies which were finalized during the previous Trump administration. So we're going to shorten the open enrollment period for the federal marketplace from November 1 to December 31 or December 15th, a little bit of ambiguity on whether those dates are correct, but that won't start until 2027. Makes some updates to the income verification process, pre-enrollment verification process for special enrollment periods. This rule will require income verifications to ensure people actually qualify for the subsidies that they are actually receiving. So we're going to see it maybe close some loopholes that allowed people to wait to enroll in a plan until they actually needed care, which should improve that risk pool overall. And it's going to reduce advanced premium tax credits by $5 a month for any individual who's enrolled in a plan that just auto renews. So if you're enrolled in a marketplace plan, we want to make sure next year that we're going in and we're updating your income and eligibility verification so you don't get hit with paying $5 more. And we're going to standardize that open enrollment period. This rule also reinstates the Health and Human Services long-standing 2012 interpretation of what it means to be lawfully present, and it will exclude the Deferred Action for Childhood Arrival, or DACA recipients, from eligibility and enrollment in Affordable Care Act exchange coverage and basic health program coverage. So keep an eye here. Of course, I'll have information going out before open enrollment, but I know you all want to hear the news as it comes out in real time. course, if you have questions, you need to review something in your policy, you're not sure how to file an appeal or a grievance or whatever you may need to do, please reach out. We're always happy to help. Have a great rest of your week.